Welcome to a 4-part infection prevention and control series brought to you by Surge Learning. In Module 1, we will be reviewing infection prevention and control fundamentals. Do you ever feel that you have had enough of infection control? So much information, so much legislation. Sometimes it seems like too many balls in the air. It can be overwhelming. So let's take one step at a time. Over the next 4 modules, we will take 10 to 15 minutes each time to work through the fundamentals to make you an expert. Infection prevention and control policies and procedures likely take up a huge binder. Taking a closer look at why we care about infection prevention and control will make this big binder seem more meaningful. Look at these stats from Public Health Canada. More than 200,000 patients get infections every year while receiving health care in Canada. More than 8,000 of these patients die as a result. They did not come with an infection, but got one with our care. Mortality rates attributable to Clostridium Difficile or C. diff infection have more than tripled in Canada since 1997, despite infection control protocols. The healthcare-associated methicillin-resistant Staphylococcus aureus (MRSA) infection rate increased more than 1,000% from 1995 to 2009, even with a huge emphasis on MRSA and routine practices. About 80% of common infections are spread by healthcare workers, patients, and visitors. Is this because we forget to follow procedures or don't see them as important? Proper hand hygiene can significantly reduce the spread of infection. This is not new information, but compliance to hand hygiene is not perfect when it should be. Best practices in preventing infection can reduce the risk of some infections to close to zero. Imagine having a situation that can be controlled with our practices and procedures. Perhaps because we cannot see disease-causing germs, that we forget the importance of following hand hygiene. Perhaps because we are healthy and well, it does not seem important. But what about others, those you care for? Those who are a part of your personal life and to whom you will share infectious microorganisms that you bring home from work. Take a moment to reflect on your personal life. Do any of these situations or similar situations apply? Is there someone who is vulnerable and at a higher risk of illness or death if they get an infection? Your new baby niece? Your brother's child undergoing chemotherapy, your best friend who has a life-threatening illness, a grandmother, a great-grandmother, anyone who is older, younger, immune-compromised, or ill is vulnerable to infection and associated complications such as death. You can become an infection control expert in your healthcare role. This will protect your clients, you, your peers, and your family and friends. Infection prevention and control is a huge topic and can be overwhelming. Let's break it down into 4 smaller modules. Chapter 1. We'll review the reason why we care about infection, understand disease-causing microorganisms, introduce the chain of infection, and understand how and why we have infection control policies and procedures. Chapter 2 will review how disease-causing microorganisms are spread. By knowing that, you will then know what infection control practices to use and when, such as the routine practices of hand hygiene and gloves. See, it gets easier as we go. Chapter 3 will review how to break the chain as part of prevention or control. We do this in 4 main ways: cleaning and disinfection, disposal, and more routine practices. And finally, in Chapter 4, we will review antibiotic-resistant organisms, or AROs, and the additional precautions needed for contact and droplet, and airborne precautions. Let's get started. Read the two definitions and the descriptor under each. Click all of those that you think apply to the definition. A microorganism is only visible under a microscope, is a living cell that requires food from the host, which can be a human. Many microorganisms are valuable to our health and are part of our normal flora. A pathogen is a microorganism that causes disease. These pathogens are the infectious agent in the chain of infection, and they can be transmitted beyond the host. Infection prevention and control practices is an effective way to manage pathogens. The chain of infection shows how a pathogen or infective agent moves from one place to another and causes infection. If you understand this well, you will understand how to break that chain and prevent or control infection. Infectious agent could be a parasite or a microorganism such as bacteria, viruses, and fungi. These disease-causing microorganisms are also called pathogens. Reservoir is the place where an infectious agent lives, such as humans, animals, insects, or in water and soil. Portal of exit is the way the infectious agent leaves its reservoir. In humans, this could be from draining wounds, nose, mouth, urinary tract, bowels, and other ways in which secretions leave the body. Modes of transmission is how the infectious agent moves from one place to another. An example is direct contact through touching secretions or droplets from sneezing landing on your face, or it could be by indirect contact, where someone touches their nose, then touches a doorknob, after which you touch the same doorknob. Portal of entry. This is how infectious agents get into the host or the body, such as nose, mouth, open skin cracks, or wounds. Susceptible host. Not all persons who come in contact with infection will get an infection. Various things determine if someone is at risk. Very young, very old, immune status, such as immunization status, and any immune-compromising situations, such as chemotherapy. As well, lifestyle and genetics are possible reasons. Eat well, get plenty of sleep, exercise, manage stress, and work on staying healthy to boost your immune status. So remember that by knowing the chain, you can then start to think about ways to break the chain, and some are really easy. Match the link in the chain by dragging each link and dropping it into the correct box on your right. In this case, someone sneezes and sends droplets out of their mouth. Follow the path. That's incorrect. Answers are: susceptible host is being overtired, not eating well. Infectious agent is the cold virus. Reservoir is a human. Portal of exit is the mouth of the sneezer. Portal of entry is the nose of the host. Mode of transmission is by droplet. In addition to understanding the chain of infection, it is important to know that there are system controls that are designed to put everything in place. It starts with federal agencies such as Public Health Canada and Fundamental Infection Control, as well as a pandemic plan, for example. The provinces and territories will put the federal strategies into place and then add specifics based on their unique needs. For example, some areas of the country have a greater threat for tuberculosis or TB due to the greater number of persons at risk. Occupational health and safety organizations are concerned as well, and they will focus on areas of safety specific to the workplace, such as sharps disposal and N95 respirator fitting. Each sector, such as acute care, community care, long-term care, retirement, and assisted living, have practices unique to them. A hospital may have a negative pressure room and the equipment to manage a potential Ebola case, where a long-term care home would not. Accreditation bodies look to see that the practices in place are consistent with legislation and standards and that the employer can demonstrate that they are effective. From all of this, the employer creates policies and procedures for their site, the staff, the clients, and visitors. This is the part that is important to you. You may not remember all of the organizations and systems that got you this far, but as an employee, you must be very familiar with these policies. The employer will monitor themselves internally and benchmark themselves against others in order to determine if they are meeting the standards set. You may be familiar with things like a hand hygiene audit or a monthly list of infections of clients and staff. This is part of surveillance. In other words, keeping an eye on things for early intervention. The employer also looks at engineering controls, such as hand wash sinks and private rooms. All of this creates an effective prevention and control program of which you are a part. There was a great deal of information in the last slide. Let's put it into our day-to-day work. Some of the policies and procedures consider all staff, clients, family, and visitors, and put into place requirements for everyone. Look at the list on the left and identify those actions which you believe to be system controls. Incorrect. This applies to staff only. Answers 1 and 2 are correct as they apply to everyone. Well, that wasn't too bad. This introduction to infection prevention and control will give you a good foundation for the next modules. You are now ready for your next step with Chapter 2, Breaking the Chain, with cleaning, disposal, and routine practices. Thank you for joining us. This presentation has been brought to you by Surge Learning. Welcome to our presentation on Infection Prevention and Control Fundamentals, Chapter 2, Modes of Transmission, brought to you by Surge Learning. In Chapter 2, we'll be learning about modes of transmission and routine practices. In our course on infection control, this chapter follows Chapter 1, Fundamentals. In Chapter 2, you'll be learning about modes of transmission and routine practices. Welcome to our presentation on Infection Prevention and Control Fundamentals. In our course on infection control, this chapter follows Chapter 1, Fundamentals. In Chapter 2, you'll be learning about modes of transmission and routine practices. Modes of Transmission, Chapter 2, Part 1. Modes of transmission mean how a pathogen moves or is transported from one place to another. Modes of transmission can be direct or indirect. Let's have a look at direct transmission. Direct droplet. Often, this is how respiratory infections are spread. Droplets, which are large moist particles, leave a reservoir in a human host by coughing and sneezing and move through the air, sometimes as far as 2 meters, to land on the mucous membranes in the nose and mouth of a susceptible host. Direct contact. A reservoir, such as an infected wound or fecal matter, are contacted directly by a susceptible host, usually a care provider's hands. The hands will need to have non-intact skins, such as an open area. This open area can be a small cut, torn cuticles, and chapped skin. The pathogen then has a direct route to enter the tissues. With indirect transmission, pathogens are first transmitted from a reservoir, such as a person, to a surface, then to another person. For example, a person may sneeze at their desk. The next person who uses the keyboard contacts these droplets, and when they touch their face, transmit the pathogen to their portals of entry, mouth, nose, and tear ducts. Airborne pathogens are very small, unlike droplets. They are transmitted into the air and can be circulating in the air unnoticed, then land on you or other objects. An example would be measles airborne pathogens, still in the air after the ill child has left the room. Another airborne pathogen is Legionnaire's disease. In this case, it starts with contaminated water, a reservoir, in air circulating units. This contaminated air is then spread throughout the building and lands on people who then breathe it in. Other indirect modes include pathogens who hitch a ride on something. This is called vehicle-borne. Examples include water or ice cubes contaminated with hepatitis A, foodborne illnesses, and soil which contains bacteria from animal fecal material. Often you will have indirect contact with inanimate objects, such as surfaces like handrails, bedding, instruments, and facial tissue that have been contaminated. Indirect contact is one of the most common modes of transmission and one that is easily controlled with cleaning, disinfecting, disposal, hand hygiene, and proper glove use. Hitching a ride is a common way for pathogens to move from one place to another. You may not be able to control that pathogens are on or in something, but you can stop the journey. Consider this list and click All that apply. Correct, as is A, B, C, D, and E. Each of these items, the linen, soiled briefs, raw food, hands, and biohazard waste, have pathogens on them. When they are not cleaned, contained, or disposed of properly, the pathogens are transferred to a new surface to be picked up and transported elsewhere. Another type of indirect transmission is by insects who transmit disease. The insect is called a vector. You may be familiar with mosquitoes and West Nile virus, or ticks and Lyme disease. Barrier protection with clothing and chemical insecticides, such as DEET, are effective in avoiding vector-borne disease. Another type of indirect transmission is by insects who transmit disease. The insect is called a vector. You may be familiar with mosquitoes and West Nile virus, or ticks and Lyme disease. Barrier protection with clothing and chemical insecticides, such as DEET, are effective in avoiding vector-borne disease. Remember, if you know how the pathogens are spread, then you will be able to prevent their transmission. This is called breaking the chain of transmission. You likely know a great deal already. Check your knowledge by matching the left and right columns above. Click on a blue box, then drag it to the correct box. Unclick to drop it in. Airborne with N95, as these particles are microscopic and require an N95 mask. Droplet with mask, as these particles are large and are stopped by a routine procedure mask. Draining with gloves and gowns, due to the potential for contact with hands and uniforms. Handrails with disinfect, since these are high-touch items with a large pathogen load. Routine practices are just that, routine, for all clients, by all healthcare providers, all of the time. This reduces the risk of transmission of microorganisms. Routine practices have a number of elements. Check all those that you think apply. Perfect! Risk assessment, PPE, waste disposal, and sharps disposal are all preventative measures. Risk assessment determines what routine practices are used. Risk assessment is done by all staff all of the time. For example, you would enter a client room and observe, does the client have a diagnosed infection, such as Clostridium Difficile? Does the client appear unwell? Does the client show symptoms of a possible infection such as a cough, fever, diarrhea, vomiting, rash, redness or swelling? Drainage of a wound. What procedure am I going to perform? An interview? A wound care? A blood pressure? A bed bath? Therefore, what are my risks of exposure to infection? All of this will determine which routine practices you will need to use. The hands of the healthcare providers are the most common means of transmission and cause of healthcare-acquired infections. Think about it. How many things and persons do you touch in a day? How many staff and clients are in your workplace? In total, how many times do hands touch something? How many microorganisms are transmitted? Literally millions of microorganisms. A hand hygiene HH program is the most effective way to reduce transmission. It includes all staff. Using point-of-care hand hygiene agents such as alcohol-based hand rubs, ABHR, with a 70 to 90% alcohol concentration, and dedicated hand wash sinks to be used when soiling is visible. It also includes an education program such as Just Clean Your Hands, plus a plan to monitor, evaluate, and improve. Did you know that hand hygiene compliance audits are a mandatory patient safety indicator? You now know why there are hand hygiene audits. Routine practices includes hand hygiene and glove use. Hand hygiene and gloves are the most common ways to prevent or reduce transmissions of pathogens. Hand hygiene includes washing with soap and water or using alcohol-based rubs. Hand washing removes microorganisms with friction and sudsing of soap. Hand rubs with alcohol destroy microorganisms. And gloves are a barrier. They block pathogens from your hands to the client and block pathogens from the client to you. Part of hand hygiene compliance is to use hand hygiene at the correct time, called the 4 moments of care. This would include using alcohol-based hand rubs, ABHR, 1. Upon entering a client room. 2. Before an aseptic procedure such as a bed bath or a dressing change. 3. After exposure to body fluids such as changing a drainage bag. And 4. When leaving a client environment. These 4 moments address both client and environment interaction. Gloves are used for contact with mucous membranes, non-intact skin, blood, body fluids, or contaminated surfaces. Hand hygiene is performed before applying gloves and after removal of gloves. Scenario: Mary has intact and healthy skin. She does not show signs of infection. You are giving her a back massage. Do you need to wear gloves? Check yes or no. In Chapter 1 and 2, you learned why we need to understand infection prevention and control, the definition of microorganisms and pathogens, how are they spread, how will I stop them with routine practices of hand hygiene and glove use. Next, you will learn how to stop them with more routine practices, disposal, cleaning, and disinfecting. Stay tuned for Chapter 3. Thank you for joining us today in our fight against disease-causing microorganisms, a presentation of Surge Learning. Welcome to our presentation on Infection Prevention and Control Fundamentals, Chapter 3, Breaking the Chain, brought to you by Surge Learning. This module follows Chapters 1 and 2. In Chapter 2, you learned about hand hygiene and the use of gloves, a barrier PPE, or personal protective equipment. In this chapter, you will continue reviewing other PPEs as part of barrier protection against infection. Routine Practices, Chapter 3, Part 1. Gowns are an effective barrier against microorganisms. When would you use a gown? Check all that apply. Correct. There are two types of masks, each used for different risks. An N95 mask has a higher filter property and is used for airborne infections such as tuberculosis or TB. A procedure mask is useful for larger droplet types of infections, such as influenza. Identify the N95 mask and the procedure mask by matching the mask type on the left with the mask image on the right. Correct. When there is a risk of contamination from possible spray, splash, secretion, or excretions, a face shield and goggles are needed. This might include irrigating an infected wound with significant drainage, or when working with a client with a respiratory infection. Using PPE correctly is essential to avoid cross-contamination. Donning. Don PPE in an order that is efficient. Drag and drop the PPE noted on the right to the correct order on the left. Correct. Order is hand hygiene, gown, mask, goggles, gloves. Doffing or removing PPE has the greatest potential for cross-contamination because your PPEs are contaminated. Taking off your PPE correctly is essential. Drag and drop the items on the left with the order on the right. And remember, when finished doffing PPE, perform hand hygiene. Incorrect. Order is gloves, gown, hand hygiene, goggles, mask, and hand hygiene. Now, where do the used PPE go? In the designated disposal. Excellent work on routine practices. These practices are enhanced with cleaning and disinfection of the environment. Let's look at this more closely. Firstly, it is important to note that your employer has policies and procedures for cleaning, disinfection, and disposal. These policies are based on research and best practices from international, federal, and provincial infection control organizations, role-specific best practices for healthcare workers, occupational health and safety legislation, and your unique environment and client needs. You must follow your employer-specific procedures. In Chapter 2, we learned how pathogens and microorganisms are transmitted and how to control or prevent that transmission with the routine practices of hand hygiene and glove use. Earlier in this chapter, we learned about other personal protective equipment as part of routine practices. Now, let's briefly consider how cleaning, disinfecting, and disposal is part of breaking the chain of infection. Cleaning removes microorganisms with soap, water, and friction. Disinfection destroys them, and disposal contains them. In other words, remove, destroy, and contain. Think about your interaction with your environment each day. How many people touched this handrail? How many of those did not wash their hands? Environmental cleaning is an essential part of infection prevention and control. Let's start with cleaning of the environment. Cleaning is a process that removes visible soiling using soap and water and friction. This is essential to do prior to disinfecting, as organic matter can deactivate disinfectants. You clean your kitchen counter of food debris prior to disinfecting it. Cleaning uses friction, water, and detergents to remove microorganisms on environmental surfaces. Removing microorganisms is effective in preventing the spread of infection. Cleaning occurs in public areas, including the floors in corridors and waiting rooms, with detergents. Patient areas are cleaned and disinfected, and surgical areas are cleaned and disinfected with a higher grade of disinfectant. Let's see what you know about cleaning in general. Select true or false for each question. Answer is true. Select true or false. Answer is true. Select true or false. Answer is false. Mops, rags, buckets, and so on need to be cleaned and disinfected between uses. The risk of contamination also determines the cleaning processes. Certain areas of touch have a higher risk. Hover over the stars to see high-touch versus low-touch areas. High-touch will, of course, have more frequent disinfecting. Clients also determine risk. An ambulatory client can move infection farther. A client who has cognitive impairment will not use infection control practices. And a client who is ill with an infection presents as a higher risk for contamination. Proper disposal of waste and the handling of soiled linen follow the same principles. Never overfill a container. Fill only to 3/4. Keep lids on all containers. Use puncture-resistant, spill and leak-proof containers for wet items or sharps. Use your PPEs, such as gloves, when disposing of items. And transport these items safely, such as a plastic container with wheels. Disposal is an important infection control practice. Consider the answers on the right and choose all that apply. Correct, plus B. Containing and removing soiled items reduces the microorganism load in the environment and therefore reduces the risk of cross-contamination. The proper handling of soiled linen reduces the microorganism load and cross-contamination. When handling linen, maintain minimum agitation with no shaking of linen and hold it away from your uniform. Roll wet linen inside of dry soiled linen, then place in the linen bag. Place the soiled linen in bags at the point of care. Avoid carrying soiled linen long distances. If heavily soiled, remove waste with a gloved hand and dispose of. Do not rinse or spray with water in client care areas. When the linen bag is 3/4 full, close the top and transport to laundry or holding area. Biohazard wastes are bodily fluids that may contain infectious microorganisms such as Staph aureus, as well as blood-borne pathogens such as hepatitis C. Biohazard waste includes blood, wound drainage, feces. Products such as dressings and briefs are disposed of in leak-proof bags to avoid contamination of the environment. In the home care environment, the worker needs to problem-solve each home situation and choose the correct disposal. Look at the items on the left and choose the disposal method from the right. You may use an answer more than once. That's correct. Sharps have come in contact with bodily fluid. Typical situations where needles or sharps may be used are lancets for blood glucose testing, insulin injections, pain medication and vaccinations. For injections and IVs, use safety-engineered needles where possible to reduce needle stick injuries. All needles and lancets are disposed of in a puncture-proof container. There are other types of sharps that require this kind of disposal. An example is included in the list below. Choose one correct answer. Correct. You have learned how to break the chain using cleaning, disinfection, disposal, and routine practices. Next, please join us for Chapter 4, Additional Precautions. Thank you for joining us today in our fight against disease-causing microorganisms. This presentation has been brought to you by Surge Learning. Welcome back to Infection Prevention and Control Fundamentals, a series brought to you by Surge Learning. This final chapter, Chapter 4, will review additional precautions with regards to infection prevention and control. This chapter follows our module on breaking the chain and will cover antibiotic-resistant organisms, AROs, contact and droplet, and airborne precautions. Additional precautions are added to routine practices and include specific application of contact, droplet, and airborne precautions to be used when specific organisms have been identified or are suspected. Recall your risk assessment from Chapter 1. Or when the client environment is contaminated, as may happen with individuals who have cognitive impairment, or when the client has an antibiotic-resistant organism. There are several types of antibiotic-resistant organisms, or AROs. These bacteria live on some area of the body. In other words, they have set up a colony called colonization. The client may not have symptoms, but when they or others are susceptible, these organisms are very dangerous. They have the ability to cause severe illness that may result in death. It is essential that we practice in such a way as to eliminate the transmission of these organisms. We do this by using additional precautions. A few types of antibiotic-resistant organisms, or AROs, are MRSA, VRE, and C. difficile. MRSA stands for methicillin-resistant Staph aureus. MRSA lives on the skin and in the nose. It can be transmitted by direct or indirect contact. VRE stands for vancomycin-resistant Enterococci. VRE lives in the bowel and fecal matter. It is transmitted by direct or indirect contact. Because it can live on surfaces outside of the body for a long time, there is an increased risk of indirect transmission. C. difficile stands for Clostridium difficile. This organism lives in the bowel and fecal matter. When normal bowel bacteria is disrupted by antibiotic use, C. difficile can take over. It causes severe diarrhea and can create toxins that cause sepsis and death. It is transmitted by direct and indirect contact. Of note here, due to diarrhea and fecal contamination, bathrooms need to be disinfected regularly, and bathroom equipment is dedicated to the client. Where possible, bathrooms should not be shared. Contact precautions are used when we will or have the potential to come in contact with a disease-causing microorganism by direct or indirect contact. In these cases, we would add gowns and possibly face and eye protection. We add additional contact precautions for known or suspected AROs, as just discussed. Also, when there is contamination of the client environment. This may happen with someone who is cognitively impaired, has diarrhea, and is incontinent. In other circumstances, the microorganisms may have a low infective dose. In other words, it only requires a very small number of microorganisms to cause a problem, such as norovirus. In this case, or where we do not know but suspect infection, such as with acute diarrhea, skin rash, and drainage from wounds, we would use additional contact precautions. Apply what you have just learned by selecting the correct routine practices for the scenario on the right. Incorrect. Correct answer includes A, B, C, D. There are times when there is evidence of known or suspected droplet respiratory infection, such as influenza and the common cold. In this case, we need to add additional precautions since the mode of transmission is by direct contact, indirect contact, and droplet from as far as 2 meters from the client. What additional precautions would you add in this case? From the list on the right, choose all that apply. Correct. Plus C. At times there are known or suspected illness where the pathogens are airborne. Examples include chickenpox, which is transmitted by airborne organisms and by direct contact with draining lesions. In this case, we would add gowns and an N95 mask. Where a client has active tuberculosis, transmission is by close contact with airborne organisms. For active tuberculosis, or TB, we need to add airborne precautions. From the list on the right, choose one right answer. Incorrect. Correct answer is B. Part of an infection prevention and control program is to keep people informed. When additional precautions are needed, your client will have a poster placed outside of the room. They're all a bit different, but they all include the type of precaution and the necessary PPE, personal protective equipment. The client's room will be supplied with all of the equipment you will need, along with disposal containers and a hand hygiene station with alcohol-based hand rub. Where it is possible, the client should have a private room and staff to be dedicated or cohorted in order to minimize traffic, which is a further way to reduce indirect transmission. You may be familiar with someone from public health visiting your workplace where an outbreak has been identified. An outbreak is when more than the expected number of individuals come down with the same infection in a specific period of time in a defined location. The specific definition for your organization will be outlined by your employer or local public health unit. For example, you may have a definition that states if more than 2 individuals come down with the same respiratory symptoms in a 48-hour period, your public health unit may identify an outbreak. Individuals could include staff or clients. Each public health unit will provide their specifics around outbreak, but the intent of their involvement is the same, which is to control the spread of this infection. We often see this in influenza season. The public health team will support, advise, and educate the team on precautions and control. They may visit the site to inspect infection control practices, including supplies of PPE and cleaning practices. They may feel it is in the best interest of the public to restrict visitors while the site is in outbreak. This is a good time for you to ask questions and collaborate with the team. Let's summarize what you have learned in these 4 chapters. Why infection prevention and control, or IPC, is important. The larger system that is involved in IPC. Modes of transmission. Breaking the chain of infection. And additional precautions. But this is not quite the end. The Infection Prevention and Control Program at your workplace has been developed from the larger system of information and is unique to your workplace. Your role is to know, understand, and follow your employer's policies and procedures, which may include immunization, screening, surveillance, lists of precautions to use for specific situations, education requirements upon hire, and perhaps annually. All this is done to keep everyone safe, the client, the staff, the families of clients and staff. If you have identified something that you do not understand, see your infection prevention and control lead. These references were used to develop this presentation. Thank you for joining us today in our fight against disease-causing microorganisms. This presentation has been brought to you by Surge Learning.